In this video, I am going to talk about infertility in male and female. According to World Health Organization, infertility can be defined by the failure to get pregnant after 12 months or more of a regular unprotected sexual intercourse. So we have different types of infertility. The first one is primary infertility, the second is secondary infertility, and the third is unexplained infertility. In the primary infertility, in this type, you have never been pregnant before, and you cannot get pregnant after 1 year of regular unprotected sexual intercourse. Okay, in the secondary infertility, you cannot get pregnant after having at least one successful pregnancy. This means you have been pregnant before, you have gotten a pregnancy before, and you have delivered, but again you cannot get pregnancy after having at least one successful pregnancy. Okay, we also have unexplained infertility. Unexplained infertility, in this type, doctors or fertility testing has not found a reason or enough evidence to show that a person or a couple is unable to get a pregnancy after 1 year of regular unprotected sexual intercourse. Okay, what about the risky factors of infertility? So we have risky factors of infertility, both male and female. The first one is age. So women who are aged between 30 to 45 years old tend to be menopause. That is when they stop their menstrual period, so they can have infertility. Second is eating disorders like anorexia, nervosa. Okay, third is excessive consumption of alcohol. If someone is consuming excess alcohol, so this drug can affect the reproductive organs. Therefore, a person can have infertility or sexual transmitted infection. So if someone has a multiple sexual partners, so he may have sexual transmitted disease. Therefore, this disease can affect the reproductive organism. Smoking. If someone is using excessive smoking, so this smoking can damage the reproductive organs. Therefore, it can cause infertility. Okay, exposure to environmental toxins such as chemicals, lead, and pesticides. The other thing is obesity or being underweight. If someone is obese, having excess body weight, or being underweight, this can interfere the normal functioning, the normal process of the body. For instance, the level of hormones in the body, or maybe how the body functions. Therefore, infertility can occur. Radiation therapy or chemotherapy. If someone is undergoing or if someone is using a radiation therapy or chemotherapy, these are drugs that are used to treat cancer, so a person may tend to have infertility. Let us discuss now separately the common cause of female infertility. Number one is ovulation disorders. If you are or not ovulating, ovulation means the process in which an egg is released from the ovaries for menstruation to occur. That is what we call ovulation. So if you are not ovulating, it is difficult for you to conceive, to get pregnancy. Number two, sexual transmitted infection is like if you are someone who has a multiple sexual partners, you may get sexual transmitted disease like gonorrhea, chlamydia, or trachomatis. Therefore, this disease can affect the reproductive organs. Therefore, you may have infertility. The third cause of female infertility is structural abnormality of the vagina, uterus, and the fallopian tube. So if there is any structural abnormality, especially the vagina, the uterus, and the fallopian tube, you may have infertility. Okay, infrequent or maybe absence of menstrual bleeding. So if you're experiencing irregular period, that is absence of period, missed period, or heavy bleeding, maybe it is difficult for you, so it will be difficult for you to get pregnancy. The fourth is surgical or congenital absence of the of the ovaries. So if you're a woman who has undergone a surgery or maybe congenital absence of the ovaries, this can cause infertility. Okay, we also have polycystic ovarian syndrome. So polycystic ovarian syndrome is a condition in which there is excess production of male hormones instead of female hormones. Therefore, this can interfere your fertility, so you may have, or maybe it will be difficult for you to get a pregnancy. Okay, we also have BID, that is pelvic inflammatory disease. So if you have a BID infection, so this is infection of the lower and the upper genital tract, that is the reproductive, or that is the female reproductive organs, that is the uterus, the vagina, the cervix, and the ovaries. So it will be difficult for you to get pregnancy because there is a blockage within the reproductive organs. Therefore, you may be infertility. Okay, if there is maybe thyroid disease, like if you're having hypothyroidism or hyperthyroidism, you may, so it will be difficult for you to get pregnancy because this disease, they cause hormonal imbalance, or maybe they cause irregular period. So it's difficult for you to get pregnant. One is if you have hormonal imbalance or if you have irregular period. Okay, the other cause of female infertility is endometriosis. So if you have endometriosis, it will be difficult for you to get pregnancy. Endometriosis is a condition whereby the lining of the uterus grows outside of the uterine wall. Therefore, it will be difficult for you to get pregnancy because this disease can cause excess or maybe heavy bleeding. Therefore, it will be difficult for you to get pregnant. The other cause is kidney disease. So if you are someone who is having a chronic kidney disease, it will be difficult for you to get pregnancy because the disease can interfere the reproductive organs, and maybe there will be structural, there will be pathological function of these organs. Okay, we also have poor ovarian insufficiency or poor egg quality. So if you're struggling with poor ovarian insufficiency, that is malfunctioning of the ovaries, maybe they are unable to release an egg. So, or maybe if there is poor egg quality, it will be difficult for you to get pregnancy. Okay, if there is genetic or maybe a chromosomal disorders, it will be difficult for you to get pregnancy. So these are the conditions that can cause female infertility. Okay, now let us discuss about the cause of male infertility. Number one is sperm problems, like the shape, movement, that is the motility, or maybe low sperm count. The second is enlarged veins, that is varicocele in the scrotum or the testicles. So if you have this disease, it will be difficult for you to give or maybe conceive a child, especially if you're a male. Okay, if there is maybe genetic disorders like cystic fibrosis, you will experience infertility. And if there is chromosomal disorders like Klinefelter syndrome. Okay, Klinefelter syndrome is a genetic condition in which a man has an extra copy of the X chromosome instead XY chromosome. So it will be difficult for the male to produce good quality egg or good quality sperm. So the male may experience maybe a enlarged breast tissue, that is gynecomastia, maybe loss of muscles, reduced facial hair, or maybe that is what he experienced. Okay, if there is maybe heat exposure to the testicles from tight clothing, or maybe holding laptops on your laps, or maybe using heating pads near the testicles. So this can cause excess temperature, which can denature the quality of the sperm. So this can affect your sperm quality, so you may experience infertility. If there is maybe surgical or congenital absence of the testicles, you may experience infertility. Okay, you may also, if you have maybe a condition called low testosterone, that is hypogonadism, you may experience infertility because there is low testosterone. One is if you have a low testosterone hormone, it will be difficult for you to conceive a child. Okay, the other thing is radiation therapy or chemotherapy. If you are using maybe radiations or maybe chemotherapy drugs, you'll be experiencing infertility. You may also have infertility if you are experiencing undescended testicles. So if you have undescended testicles, you may experience infertility. Sexual dysfunction is like erectile dysfunction, premature ejaculation, or maybe retrograde ejaculation. So it will be difficult for you to conceive. So these are the cause of male infertility. Okay, let us discuss now the possible diagnosis of infertility, both male and female. Your doctor will perform a number of diagnoses for him to confirm if you have infertility. Number one is an pelvic exam. So if you are a female, your doctor will do a physical exam on the pelvic to confirm if you have any maybe structural abnormalities, tenderness, or maybe any other problems in your pelvic. Your doctor will do an ultrasound scan on your reproductive organs to confirm if there is structural abnormalities. Your doctor will also perform a semen analysis, especially men, to confirm if there is a maybe poor sperm quality, low sperm count, the movement of sperm, the shape, or maybe if there is low testosterone hormone level. Okay, your doctor will do a blood test to confirm if you have maybe a thyroid disease, or maybe your doctor will do a blood test to confirm if there is a genetic or chromosomal disorders. So your doctor will do a proper medical history checking to confirm if you have the disease. So these are the ways in which your doctor will do a number of diagnoses to confirm if you have infertility. What about the treatment? So what treatment is available in fertility? Generally, it is difficult to treat infertility, but doctors always find possible solutions, maybe to help you get a pregnancy, to help you conceive a child by performing the following through lifestyle modifications. If you're someone who is obese, that is being overweight or underweight, your doctor will maybe recommend you to maintain your body weight. So that's what we call lifestyle modification. So your doctor will encourage you maybe to perform a well sedentary lifestyle. Okay, your doctor will also provide for you medication. Your doctor will also prescribe for medications, maybe if there is a hormonal imbalances, or maybe if there is poor egg quality, if there is maybe a defects, maybe if there is a damage in your reproductive organs, your doctor will prescribe for you a number of medications to treat infertility. Lastly, your doctor will perform a surgical, that is surgery, maybe if you have any defects, structural abnormalities in the vagina, the cervix, the uterus, or if you're male, if you have any structural abnormalities in your testicles, maybe the prostate. So your doctor will perform a surgical, maybe to remove that, or maybe to correct the normal functioning of these reproductive organs for you to get a child or conceive. So I hope the video is very helpful. So if you find the content helpful, kindly please hit the subscribe button, like and share, and give your comment this video.